The modern medical system is designed to manage your illness, but it is often dangerously bad at honoring your intuition. After 20 years in internal medicine, I have stood at the bedsides of thousands of seniors who told me the same heartbreaking thing. I felt something strange yesterday, but I thought it was just old age. That strange feeling was a life-saving telegram from their brain. But because it was ignored, the telegram was burned, and the stroke arrived. Every 40 seconds, a brain in this country is changed forever. We are told strokes are accidents or bolts from the blue. That is a lie. A stroke is not an event. It is the predictable endpoint of a process simmering for years. In this video, I will reveal 5 early warning signs of a transient ischemic attack, TIA, and the medical steps needed to prevent a full-blown stroke. I am breaking the silence on the 72-hour warning window that a standard 10-minute doctor's visit almost always misses. I will show you why your blood pressure might be a nighttime trap and how your skin predicts your brain health. If you value your independence and want to stay in your own home, not a nursing home, you cannot afford to look away. This is the biology of your second chance. Before we continue, how old are you, and what is the one strange symptom you have been ignoring lately? Let me know in the comments below. The anatomy of a warning shot. Most people think a stroke is a blood vessel exploding. While that happens in about 15% of cases, what we call a hemorrhagic stroke, the real thief is the ischemic stroke. This is where a vessel doesn't tear, it clogs. Think of it like a rusted pipe that finally gets a piece of grit stuck in the middle. Your brain is the most demanding tenant in your body. It weighs only about 3 pounds, yet it guzzles 20% of the oxygen you breathe and a quarter of all the sugar in your blood. It has no backup battery. If the fuel line is cut for even 4 minutes, the lights start going out forever. But here is the whistleblower truth. Your brain almost always sends out a warning spark before the fire. In my world, we call this a TIA, a transient ischemic attack. Transient is just a fancy medical word for it went away. Because the symptom vanishes in minutes, most seniors tell themselves, "I'm just tired," or "I stood up too fast." That is a dangerous mistake. A TIA is your brain's final scream for help. Research shows that a warning spark often precedes a massive stroke by exactly 72 hours. Those 3 days are the most critical window of your life. If you know how to read the code, you can stop the fire before it starts. Warning sign number 1, the window shade effect. Imagine you are in your kitchen, making tea. Suddenly, your right eye goes dark. It's not blurry. It's as if someone pulled a gray or black window shade halfway down over your vision. You rub your eye, you blink, and 30 seconds later, it's gone. You feel fine, so you go back to your tea. In the exam room, I call this amaurosis fugax, but you should think of it as fleeting blindness. That shade was likely a tiny, microscopic piece of rust, cholesterol, or a blood clot that broke off from the big artery in your neck. It traveled up and plugged the tiny artery feeding your eye. Why is this a fire alarm? Because the artery to your eye is a direct branch of the artery to your brain. If that piece of rust had floated just 2 millimeters to the left, you wouldn't have just lost your vision for a minute. You would have lost your ability to speak or move your arm forever. If you see that shade pull down, even for 10 seconds, do not wait for it to happen again. Your neck artery is spitting clots, and the next one is headed for your brain. Have you ever experienced a sudden, unexplained fog in just one eye? It's a question that could save your life. Warning sign 2. The rubber arm and skewed sensation. We all know the feeling of our foot falling asleep because we sat wrong. That is nerve compression. But a stroke warning feels different. It is what I call the rubber arm. It is a sudden numbness or a pins and needles sensation that hits one side of your body and only one side. Your brain is divided into two halves. The left side of your brain is the map for the right side of your body and vice versa. When a small clot briefly blocks the map for your left arm, that arm suddenly feels like it belongs to someone else. It feels heavy, like cotton or rubber. Here is the hammer sentence you must remember. If it happens on both sides, it's likely your neck or spine. If it happens on only one side, your arm, your leg, or the corner of your mouth, it is a brain event until proven otherwise. Do not blame your chair. Do not blame your posture. If your arm turns to rubber while you are just sitting and talking, your 72-hour clock has started ticking. Are you still with me? Because the next sign is the one most people mistake for just getting old. Warning sign number 3, the drunk walk, without the drink. We've all had moments where we trip over a rug. But the third warning sign is a sudden loss of coordination that I call the spontaneous stagger. You are walking across a flat, familiar floor, and out of nowhere, your leg forgets where the ground is. You veer to the side as if someone pushed you. This happens in the cerebellum, the small extra brain at the base of your skull. It is your body's gyroscope. It tells you where you are in space. The cerebellum gets its blood from arteries that run through the bones of your neck. If those vessels are narrowed, your gyroscope glitches. You might feel a violent spinning sensation, vertigo, that makes you grab a door frame. People often tell me, "Oh, I just had a dizzy spell." But if that dizziness comes with a zigzag walk, it isn't just an inner ear issue. It's a vascular warning shot. Warning sign number 4, the broken language loop. This is perhaps the most frightening sign. There are 2 command centers for speech in your brain, usually on the left side. One helps you form words, Broca's, and the other helps you understand them, Wernicke's. In a TIA, you might know exactly what you want to say. Pass the salt. But what comes out is, pass the sissoon. Or worse, you might speak clearly, but the words come out as a word salad that makes no sense to your spouse. If your speech breaks for even 60 seconds, your brain is losing its grip on its most complex function. I've had patients tell me they thought they were just having a senior moment. Let me be clear. A senior moment is forgetting where you put your keys. A stroke warning is forgetting how to use the word keys. Warning sign number 5, the hidden connection, vitiligo and headaches. This is where I reveal something most general practitioners miss. Have you noticed white, pigment-free patches developing on your skin? This is vitiligo. It is an autoimmune condition where your body attacks its own cells. But here is the whistleblower secret. The immune system rarely stops at the skin. If it is attacking your pigment cells, it is often quietly inflaming the endothelium, the microscopic, non-stick coating of your blood vessels. Think of your endothelium like a Teflon frying pan. When it's smooth, blood glides right through. When it's inflamed and scratched, cholesterol and clots stick to it like burnt eggs. If you have vitiligo and you start developing new, unusually intense headaches, your Teflon might be failing. It's time to stop waiting and seeing. The blood pressure paradox. Now, I want to give you a cognitive jolt. Most of you have been told that high blood pressure causes strokes. That is true for burst strokes, but many ischemic strokes happen when your blood pressure is too low. Imagine a garden hose that is 90% clogged with sand. To get water to the end of the hose, you need high pressure. If the pressure drops, the water stops moving entirely. This is the nighttime trap. Your blood pressure naturally dips by 20% while you sleep. If you already have narrowed arteries, that normal dip can cause the blood flow to your brain to stall out completely. This is why so many people wake up with a stroke. They went to bed fine, but their blood pressure dipped too low to push past the sand in their pipes. The protocol, your 72-hour action plan. If you experience any of these signs, you are in the 72-hour window. Here is exactly what the system won't tell you to do in a simple, clear way. Tip 1. The 3x half-minute rule. If you wake up in the night to use the bathroom, do not jump out of bed. Lie still for 30 seconds. Sit on the edge of the bed for 30 seconds. Stand still for 30 seconds before walking. This gives your blood pressure time to stabilize so you don't stall out the flow to your brain in a dark hallway. Tip 2. Demand the duplex ultrasound. Don't just ask for a checkup. Ask for a carotid duplex ultrasound. This test doesn't just look at the shape of your neck arteries, it measures the speed of the blood. If the blood is whistling through a narrow gap, you need to know today, not next year. Tip 3. The A1C truth. High blood sugar is like pouring acid on your Teflon coating. It makes your vessels brittle. You must know your hemoglobin A1C number. Anything over 5.7% means your pipes are being damaged every single hour. Tip 4. Catch the heart flutter. Ask your doctor for a 24-hour Holter monitor. Many strokes are caused by atrial fibrillation, a heart rhythm that swirls the blood instead of pumping it. That swirling blood creates clots that shoot straight to the brain. A 10-second EKG in the office almost always misses it. You need a 24-hour look. The critical warning. The aspirin trap. I need to issue a stern warning. If you think you are having a stroke, do not just swallow an aspirin because you saw it in a movie. Remember, there are two types of stroke: clogged and bleeding. If you are having a bleeding stroke, aspirin will make you bleed faster and could kill you before the ambulance arrives. Only a hospital CT scan can tell the difference. Your job is to get to the hospital, not to play pharmacist. We have covered a lot of ground today. You now know that the window shade in your eye, the rubber arm, the stagger, and the broken speech are not signs of aging. They are the warning sparks of a 72-hour window. You've learned that your blood vessels have a Teflon coating, that sugar and inflammation can scratch. You've discovered why the nighttime dip in blood pressure is a hidden danger for narrowed arteries. And you now have the names of the 3 tests: carotid ultrasound, A1C, and the Holter monitor, that can give you your life back. I'm telling you this because I've seen what happens when these signs are ignored. Independence is the most valuable asset you have. Once it's gone, it's nearly impossible to get back. But if you act in that 72-hour window, the warning spark doesn't have to become a wildfire. I want you to do one small thing. Sit down with your spouse or a loved one and describe these 5 signs to them. Tell them, if you ever see me stagger or hear my words get jumbled, don't ask me if I'm okay. Just call 911. If this whistleblower, look into your brain's health, made sense to you, please share this video. There is likely someone in your circle right now who is ignoring a rubber arm or a blurred eye, thinking it's nothing. You could be the one who saves their 72-hour window. Hit the like button and subscribe to join our community of seniors who refuse to be managed and instead choose to be informed. Professional medical disclaimer. This content is for educational purposes only and does not constitute professional medical advice, diagnosis, or treatment. Always consult a physician or qualified health provider regarding any medical condition. Never disregard or delay seeking professional medical advice based on this information. In the event of a medical emergency, contact your local emergency services immediately